Now that laser therapy is in the forefront of a lot of medical treatment, it's really entered the field of dentistry. We use lasers now to help people treat their gum disease on a pretty frequent basis nowadays. So we no longer have to use a scalpel and sutures and do some of the things that we used to do. It's still a treatment that we have to do at times, but if someone has a certain type of gum disease that laser is indicated for, it's a wonderful treatment to be able to arrest their gum disease, do it in a much more atraumatic manner, much less uncomfortable. A lot of our patients go back to work the next day. They don't have sutures. It's a fairly rapid recovery, and the benefits can be long-lasting. We've done laser therapy over the last 7 years, and I've really liked the results that we're seeing in patients, and the patients like it because it's so much less uncomfortable than some traditional procedures that we've done for patients. You know, one of the great things about laser therapy is if we get your gum disease healthier, there is a relationship between other parts of your body actually becoming healthier as well, or responding positively to that better, healthy mouth that you'll have, and lasers are helping us do that. Probably the most ideal candidate for laser type therapy would be people that haven't lost a lot of bone yet, who are kind of in that moderate stage of disease, which can be well explained from your hygienist or your dentist, or we can certainly tell you all about it. But if your dentist tells you, you know, you're kind of experiencing these pockets or these conditions where they're just not resolving from the technique that they're trying, call us and give us an opportunity to tell you how laser therapy may be able to benefit you in the future. The technique of how the laser is used here is to be able to use some light energy between our gum and our tooth in order to eliminate the infection that's actually present in our gum tissue, because gum disease is kind of a combination of bacteria that lives in our tooth structure as well as bacteria that has gone into the gum tissue and infected the actual tissue around our teeth. So that laser does a wonderful job of introducing that light energy into that tissue where the bacteria can't tolerate it. So it literally removes all the unhealthy gum, but yet it leaves the healthy gum tissue behind. It also gives us the opportunity to clean your teeth really well, so we can physically remove the bacteria that are adhering to your tooth structure. And then the really great thing about the end of that procedure is we literally just create small little blood clots to actually unite the gum and the tooth back together, so it no longer needs sutures and some of the things that we would do traditionally. Patients just leave with really an unrecognizable, very thin, small adhesion between their gum and their teeth. And we check on them in a couple of weeks as that tissue is beginning to heal, and they will go through some pretty specific care that we'll instruct you with, and the recovery is quite quick. Most of our patients go back to work the next day.